Hi, my name is Dr. Paul Nassif, and I'm a facial plastic and reconstructive surgeon in Beverly Hills, California. And I specialize in rhinoplasty. And this is my video blog, and I have patients from all over the world send me emails, and this is how I answer them. And this one patient asked me, how long does it take to recover following a rhinoplasty? And this is a great question, since this is a question that everyone asks. And let's start off by saying that if you're coming from out of town, I'd like to have the patient stay here about 2 weeks if possible. So during your first week, you have a cast on your nose and you're bruised, and you may have little stitches that are right in the lower part between your two nostrils that may need to come out after a week. The second week of healing, the cast comes off, sutures come off at the end of a week, and then we put tape on your nose for the second week. And now by the end of the second week, your bruising starts to slowly go away. And we use things as hyperbaric oxygen and arnica and platelet gel to help you heal faster. And if you're interested in reading about hyperbaric oxygen or platelet gel, please see my website at Rhinoplasty and go into those sections and you can read about hyperbaric oxygen or platelet gel. After that initial 2 weeks, your nose starts to look a little better, but you're very swollen. After 4 weeks, your nose looks pretty decent. You probably have about 50 to 60% of the swelling resolved at that point. At that point, you can do some light exercise at 4 weeks, and you can gradually get your exercise up to track at 6 weeks. So at 6 weeks, you should be able to perform your maximum amount of exercise. But if you notice that your nose is becoming very swollen, you want to back off. But during that initial few weeks, you really want to curb your routine, doing anything strenuous. Like I said, if you notice that your nose is swelling after doing any activity, you want to back off. That means you're not ready to have any vigorous activity. The next phase of healing now after 4 weeks is about 3 months. At 3 months, your nose is about 85% healed. It's pretty strong. The nasal bones are pretty darn strong. And the tip is strong, and also there's still nasal swelling in the tip. At 1 year, you're about 95 to 96% healed. Your nose will never be 100% healed because it keeps changing every year. But the bottom line is you have to give your nose time to heal and be very patient. Okay? And the biggest problem patients have is they'll call me up or call other doctors across the country and say, how can I help get rid of the swelling? When is it going to go away? And yes, there are things we can do in the short term, as I mentioned, the platelet gel, arnica, hyperbaric oxygen, but patience and waiting is going to be your #1 way to make your nose heal. Getting nervous after surgery, overdoing it, will only prolong your healing. Thank you very much.